Dr. Brady Wyrick, good day to you, sir.
What is happening?
Just living the life in a very orange red reality right now, honoring my circadian rhythm. How about yourself?
At your time of night, it is especially important to be rocking those.
Yep.
You're 2 hours ahead of me, so you're 7 o'clock. So yeah, you're right in that window. That if it was 7 o'clock here, I'd have them on too. I'm
Yep.
doing
I'm,
great,
I'm from
man.
the future. I don't know if you knew that.
Should we call you Neo?
I got to work on dodging my bullets a little bit better first, but I'll work towards that. So I want to thank you for, the week between Christmas and New Year's is a tough run up. People are busy. So I want to thank you for taking the time to do this first and
Yeah,
foremost.
absolutely. It is. It's my pleasure. I'm passionate about this stuff, so it's really fun for me to be here. And yeah, I'm excited for this conversation.
Well, I don't know if you've seen any of the master classes, but it's all about showcasing unique professionals and their genius. It's, in my opinion, education for education's sake. You giggled at genius there, so either you're nervous or you're happy inside for that word. And
So
then ultimately, what we want to do is basically dole out a lot of your expertise in terms of wisdoms and nuggets of information to the people who may be watching this.
sure, sure.
So the first thing I always start with is I always want to know the person's story because you're our first functional neurologist. So before I actually help you, decode that word through questions, tell us about your story. What got you here?
Oh man, how far back in the Wayback Time Machine do you want me to go? Forgive me, I'm having a couple notes printed and brought into me because I have some lists of stuff I like. Um, so I grew up in Ogden, Utah, just north of Salt Lake City, and I was raised by my parents who did a lovely job. This is nothing against them or how they raised me, but we were in a very medically minded family.
Hmm.
Doctor knows best. I had a flu shot every year from the time I was born until I was 18 and could decide for myself. I had every lump, bump, scrape, bruise, whatever. It was off to the doctor to see what prescription there was. I didn't like it. It never really resonated with me. And I always had like this ingrained, like America's over medicated and we're not really fixing anything. And that was kind of my whole attitude. Fast forward, I went on a mission for my church in Houston, Texas. That's where I found chiropractic. Uh, Long story short, fell in love with it. Came back, went to Weber State University, did what I needed to do to get my undergrads done. Went back to Houston to chiropractic school, and then while I was at chiropractic school, I found out that chiropractors have specialties just like the medical community does. That's where I found this whole chiropractic neurology, functional neurology, whatever you want to call it. And back then, you could actually take those courses while you were in school. So that's what I did is I took all those courses. And then by the time I graduated, I had enough hours to sit for the neurology board, et cetera. That was the beginning of my career. My career has evolved. I came out I've been in private practice ever since I started. I did have a brief 2-year stint where I thought it would be fun to go try out a multidisciplinary clinic, basically working for somebody else. And turns out my personality doesn't jive with that. So
You know.
imagine that, right? So basically what I'm doing now is I have a lot of different different aspects to my practice. There is the functional neurology aspect of it, where what we use a lot is diet combined with Erconia laser, my latest passion. We have a weight loss program that's basically a functional medicine program. It's an anti-inflammatory protocol labeled up and packaged with a cute bow that says weight loss, because people here will pay for weight loss, but they won't pay for functional medicine. And we have the stem cell part of the business. We're doing a lot of stem cell injections for different joints and so forth. And we are getting started on a piece that uses stem cell products for wound care, which is pretty fascinating. So I'm trying to unpack and unravel the mysteries of Medicare, because that will give us a piece of this business that will be provided by Medicare, where everything else is cash. So
Got it. So you're basically becoming a renaissance man of chiropractic diversification.
I consider myself a healthcare entrepreneur.
Got it. And
So,
that's a wonderful thing because you're bringing health into a different paradigm, and you're also helping people take responsibility for getting outside of not taking care of themselves because you're forcing them to do that.
we live at a great time, Roland, and you're a few years younger than I am. We live in a great time because you can feel this momentum building. People are so sick and tired of uh, being sick and tired, and they're starting to discover that these big pharmaceutical companies, government agencies, and so forth are flat, bold-faced lying to their faces about what it takes to be healthy, and people are starting to push back. And at the end of the day, it's guys like you and me and gals like Kelly Halderman and so forth that we're the ones that have the answers. We're the ones that have the keys to really taking care of yourself.
Well, yeah, there's an old saying that says the patient of today is the doctor of tomorrow. So I would like to think that there is a utopian society where people are taking responsibility for their own health because not only do they have the power, they have the interest, the desire, and they're willing to put in the work. We could go down that pathway, but I did want to selfishly pick your brain on a couple things because I don't get to talk to many functional neurologists
Sure.
personally. I've
So
spoken to neurologists, but I want to ask you, what the heck is a functional neurologist and
sure.
how does it differentiate itself from a traditional allopathic one?
Sure thing. So before we get too far into this, I meant to start by just apologizing in advance. We are in my home, and you mentioned earlier that it's the week between Christmas and New Year. Between my wife and I, we have 8 children, and one of them is married, and everybody's here. So there are 9 children in this house from the ages of 24 down to 9, plus 2 large dogs. So it may not be perfectly quiet on my end. Like I'm sequestered here in the office, but you may hear
All good. I wouldn't
stuff.
have known unless you said something.
Okay, so here's the way I explain it to patients. Okay, traditional neurologists, they focus on what I like to call STDs, and not the STDs you're thinking of, Roland.
Thank you
They
for that.
focus on strokes, on tumors, and on diseases that have names that there are drugs for.
Hmm.
If you fall outside of those parameters, then whatever your problem is, it's in your head. You got to learn to live with it. Go get a puppy, make yourself happy, or go see a psychologist. Like that's literally like what their answers are. So, as far as strokes are concerned, those first few minutes of that stroke are absolutely crucial. And there's not another country in the world that if I'm going to have a stroke, I would want to be anywhere else but here. But when it comes to a lot of the other stuff, I think they get it wrong. So here's where functional neurology comes in. Let's say that you have let's say you're dizzy, okay, and that's your main symptom. Well, you go to the doctor, and or you go to the neurologist, and you say, "I'm dizzy," and he might do some tests for the old, the rocks in your ears, the BPPV thing, but he or she will probably order an MRI, and they'll take a look at that MRI and see that there's nothing on that MRI, so it must be in your head, go on your way. Well, to me, that is like taking your car to the mechanic and saying your engine's knocking, and they open up the hood of the car, they take a picture of the engine, close the hood, look at the picture and say, there's nothing wrong with the car. They're not digging into it.
Hmm.
Okay, they're not pulling the codes, they're not lifting valve covers off, they're not looking at what's actually going on with the car. That's where we step in. So a functional neurologist is going to look more at what nerve pathways aren't firing the way we should. Okay. What is an absolute solid truth is that nerves that fire together wire together. So the stronger you make a nerve pathway, the more you fire it, the stronger it's going to get. So if nerve A is connected to nerve B and nerve B is connected to nerve C, if you fire A, by law, and I don't remember whose law it is, but there is a law from someone's name, nerve C has to fire, and the more you fire that pathway, the stronger it gets. So if you go back and look at my social media feeds, I got a gal on there that came in because she was dizzy. Well, we were able to isolate which one of her canals from the semicircular canals were the issue, just based on some eye movements and how her muscle strength. and we fired that particular pathway. In my case, we did it with a laser, and instantly those pathways came back online. Her dizziness has been gone since. Whereas that's someone who would have spent thousands of dollars and a ton of time in a system that never really would have gotten anywhere. So come back and make that a synopsis. What is a functional neurologist? Someone that looks at the whole person, figures out what nerve pathway is the issue, figures out ways to fire and exercise that pathway to build up that plasticity or make that nerve pathway higher or stronger and get the individual better. How's that?
That's a fantastic explanation, because in my mind, I think, as you said, a neurologist is someone who's dealing with a neurodegenerative condition. So usually it's something like pretty high level in terms of its need for triage, and of course you're getting into some pharmaceuticals.
Right.
But we never really think of a neurological condition not being something that's a diagnosable disease like Parkinson's or something of that nature. What do you think are the causes that you see of, we'll call it lower level non-specific neurological conditions that show up in your clinic?
What are the causes of that?
Are there factors that are causing those things that you've been seeing within the health community?
Yeah, it's this thing, this ubiquitous thing that we have a big time problem with in this country, and it's called the standard American diet. The number one cause of neurodegenerative disorders is bad gut health.
How fitting.
Stew on that for a minute. Okay, we do not take care of our guts. And we do not eat an appropriate diet. Like the whole food triangle, and I think the Obama administration, this isn't a political thing, they brought in the food plate. If you look at those things, like they don't make any sense except for they sell products. It has nothing to do with health. And because of that, we're seeing these epidemics of, diabetes, Alzheimer's, and other neurodegenerative disorders that are crippling us. They're crippling our system. And at the end of the day, there's really no answer for those that the medical community has. You have to take care of yourself.
So what you're saying then is it's inevitable that functional medicine and functional neurology kind of collide together, because what you're talking about is if you see a neurological condition and you're saying that a lot of those problems originate not within the neurology itself, but within the gastrointestinal tract, we're really talking about the gut-brain axis. Is that fair?
That is 100% factual. And to be completely transparent, that is the only thing that you and I have discussed up until this point. We have not sat down and scripted any of this. It was like, hey, let's talk about the gut-brain axis. And that's the direction, definitely the direction that we need to go, because that is a huge issue.
The gut-brain axis is something that gets thrown around quite frequently in health conversation, be it on podcasts or in lectures or even between two professionals. How do you define the gut-brain axis? Like, what is the core philosophy that you're looking at within the gut-brain axis, knowing that it's talking about the brain, all the organs of digestion, and the vagus nerve?
So, boy, let's define the gut.
Okay.
When we're talking about the gut, it starts right here in the opening in your mouth and ends at the opening on the other end. Okay, every single little aspect of what food goes through when you stick it in your mouth and start chewing it, or even when you get it up to your nose and you smell it, your saliva contains these enzymes that help break that food down, and you start mechanically breaking it down. And I love what you said a while ago. Your mom used to say to you, your stomach doesn't have teeth. I got that from you, Roland, and I use it every day.
Here you go. Just cite me every so often.
So from that to food hitting the stomach, where the acid that is supposed to be there starts breaking the food down. So you start breaking your proteins down into absorbable proteins, and then pushed into the small intestine, where it's broken down even further, and your vitamins start getting absorbed all the way down through the colon. That is your gut. Okay, that is the one. That is where most of your immune system is actually held, is in that system. Okay, so literally 3 times a day, sometimes 5, 6, 7, sometimes 8 times a day, we are insulting that system by putting absolute trash into our mouths and breaking that and expecting it to break down. Okay, so what is the purpose of that? The purpose of that is so that you can get fuel out of your food. Your cells absolutely need glucose and oxygen for them to make energy, ATP. Well, guess what system of your body consumes 30% of whatever you put in your mouth?
Guessing it's your brain.
It is your brain. It's 100% your brain. Look at the anatomy. Hey, look at your heart. Hey, your heart, you have your aorta. Your aorta comes up and makes your aortic arch and then drops back down to feed blood to your entire system. What's the first branch that comes off the aortic arch? Where's it going? Up into the brain. Okay, the second branch up into the brain. That's where most of your food, or that's where most of the fuel goes. So it would make sense that if we're going to break down metabolism, what system is going to get affected first?
Probably the most energy dependent, energy hungry one. Yeah.
Okay, so it's funny to me, like I'll sit down with patients, that come to me because they want to lose weight. And I refrain from telling them, and I probably should tell them, that the bigger the circumference of your gut, the smaller your brain is going to be. They're inversely proportional. But I will tell them, I'll say, look, in the first few weeks of working with us, you're going to be really happy with the weight that's coming off. That's going to be really cool. But what else is going to happen is you're going to have less joint pain. Your skin's clear. You're going to sleep better. But lo and behold, guess what else is going to happen? Your thoughts are going to be clearer. Your brain fog is going to be gone. You're going to just feel mentally sharper, more acute. And the reason for that is we're getting rid of some of the inflammation in your diet. Your brain's getting adequate blood flow, and all of a sudden things start working again. But if you keep insulting it for 60 years, guess what's going to happen? Your brain's going to stop working to the point that you'll get to this thing called type 3 diabetes. And type 3 diabetes is what?
Insulin resistance of the brain.
Insulin resistance of the brain. Because when your brain doesn't get fuel, doesn't get activation, then you're in a world of hurt.
So where does the vagus nerve come into all this stuff, right? Because everyone talks about the importance of the vagus nerve and digestion. You know, for people who haven't delved deep into it, what is your approach with stimulating vagal tone and maintaining vagal function in the gut-brain axis?
It's a good thing we have an hour, Roland. The vagus nerve. So first off, let's take a couple steps back in the anatomy of this thing. Okay, you have 12 cranial nerves that originate from your brain or brain stem, and they're called the cranial nerves because they exit your cranium through different orifices rather than your foramen magnum. So there's other holes for these particular nerves to come out. Mm-hmm. And they're going to control things like your eye movements, taste, smell, digestion, and even some muscle movements for your tongue and for your shoulders. Okay, so the vagus nerve is one of those particular cranial nerves. So it comes from the brain stem. Okay, and if you start breaking the brain stem down, I think it comes from the pontomedullary junction, but I did not go back and review that. But if you break the brain stem down, you have the upper part of the brain stem, which is called the mesencephalon or midbrain. And then below that, you have your pons, and then you have your medulla below that. And I always think of Bobby Boucher.
Waterboy.
A medulla oblongata. It has nothing to do with anger. That was Hollywood. Hey, but it makes me laugh.
I thought crocodiles were angry because they didn't have teeth. Sidebar. Just watch the movie.
And no toothbrush.
Yeah.
That's your homework, to go watch that show. No, the pons, or the medulla and the pons, are the on-off switch for your parasympathetic system. The midbrain is the on switch for your sympathetic nervous system. Okay, yeah. So the reason why you are wearing those particular glasses at this particular hour is because your optic nerve, which is cranial nerve number 2, fires a direct link right into your midbrain, okay, and it excites your brain, and it puts it in this excitatory state. Okay, so if you get into this sympathetic state and you go this sympathetic windup, as we call it, you're not going to sleep very well. That's what shuts your melatonin production down. Okay, so if you put those glasses on, you don't have that, and it calms everything else down. Backing up, the vagus nerve comes from the lower part of your brain stem. Okay, and that lower part of your brain stem is all about rest and digest. Okay, so the vagus nerve, vagus means the wanderer, is going to come from that lower part of your brain stem. The thing is massive. Have you ever seen it on dissection?
I have once actually. It's really
It's like a
cool.
pencil. The thing is gigantic. Okay, it's going to come down and it's going to have branches that come to your heart, to your lungs, to help control and slow down respiration when you get into that feed or breathe state. Okay, and then it's going to have these branches that come down that control your diaphragm all the way down into your gut to help control and to activate digestion. Okay, so if you are in a chronic state of stress, that system's not going to work very well. Okay, it's going to get shut down. That makes it so that you don't digest food very well. It's going to make it so, you know, you think about this, put it this way. If you're being chased by a tiger, how well are you going to digest food?
Not very well, but I'm going to crowd myself pretty efficiently.
Right? People live in that state, Roland. Like, we are literally afraid of, well, it's a, what's the word I'm looking for here? It's an evolutionary thing that was put into us back in the day when we literally had to fight for our lives. Like, we had to have this system. Otherwise, you know, if the tiger comes, we can't defend ourselves. We can't get away.
Could be a jellyfish.
It could be a jellyfish. It could be a rattlesnake. I don't know. Okay. But here we are in a day in right on the brink of 2023. And we're literally like put ourselves in these states of fear of things that are coming that aren't going to kill us, but just can cause us stress. Like, oh my gosh, what if I can't make my car payment? Oh my gosh, what if? Oh my gosh, what, like that whole false evidence appearing real thing is driving a lot of these neurodegenerative disorders. So you're putting crappy food in, you're stressed out all the time. It's no wonder by the time you hit the age of 50, you walk into a room, can't remember why you're there. Right? So that's how it plays a role in this. But the good news is there's something you can do about it.
Well, it's a beautiful segue because it's so, I mean, thank you for giving us that amazing description, because people talk about the autonomic nervous system very, you know, casually, and there's this term called mutual mystification, where if two people are discussing the same thing but they've not established their baseline understanding, they could have a full-on conversation not really knowing what each other are talking about. So the fact that you delineated the two branches of the autonomic nervous system to help us greater define the gut-brain axis was incredible. And your question, the question I have with your nice segue is, so it sounds like a big part of your clinic is getting the autonomic nervous system balanced, getting people out of stress.
Right.
It's also getting people to optimize their digestive function, shall we say, to turn on the organs of digestion. How do you smash those two things together practically in the clinical setting?
Okay, so in the clinical setting, again, I'm going back to the laser because it's
do it. Talk about the laser.
It's something I'm passionate about. It's something that I'm new. That's relatively new to me. I've been around lasers my entire career, but I ended up going to one. And this is not like an Arconia seminar. If you want me to stop saying Arconia, Jeff, please just send me a text or whatever. But I go to this seminar thinking, yeah, I need to get the hours. It'll be easy. You know, I could. But anyway, it ended up being like life-changing for me. So what I'm doing now is there's actually ways of testing those cranial nerves. And when you find weaknesses in those cranial nerves, you can actually use photonic energy to get a photochemical response inside of the brainstem by light.
It's incredible.
You can see like immediate results. Okay, and let me use one example. Here's a clinical example. Okay, my accountant calls me, and he's he's worried about his daughter. He's got a 32-year-old daughter, I think she is. She goes in to have her veins stripped in her legs and has a stroke that hits her thalamus. Okay, this is a 32-year-old, and she's got 3 little kids. She's working as an accountant, and she's trying to keep her life together. Okay, so she's under stress, and her brain is not allowing her to perform her activities of daily living. Well, it turns out she lives about 250 miles from here. She can't even make the drive herself. So she comes up on the weekends to see her parents. And of course, I have her come here, and we start doing some of these cranial nerve testing, and I start finding some weaknesses. And I know it's a thalamic stroke because I can see the imaging. I can read the reports to say where it is. Well, I start having her do exercises. We find out that her tongue muscles are weak. Because of the stroke, that part of her brainstem is decreased. So I start shining the laser over where her lower brainstem is. I start having her do these tongue exercises, and all of a sudden things are starting to change for her. Like within 1 weekend of her being here, life is completely different. Like she's able to function. She's able to start feeling human again. She's actually starting to feel some hope, because all she's been told up until this point is you just learn to live with it. Like it'll get better eventually. Well, we accelerated it. I gave her some dietary recommendations, which are pretty basic. Avoid the big inflammatories, sugar, corn, gluten, soy, etc., dairy. I put her on some Natozyme, and right now I see her about once a quarter. And because we started doing that and started building up some plasticity in that particular system, she's doing remarkably well. So there's my clinic example.
Incredible story. Thank you for that. So it sounds like what you wanted to do was restore the flow of energy in an area that has been diminished, compromised as a result of the stroke, because the circulatory system delivers oxygen and nutrients. Last time I checked, kind of important to make sure energy metabolism is being maintained in cells and tissues. Shining the laser is something that helps to bring in photonic energy, that's light energy. The body can take that as a proxy and repurpose that energy to turn nerve pathways on, because they are what? Electrochemical, right?
Right.
But in addition to that, I imagine you would use different supplements. With her, obviously, it was Natozyme, but
Right.
are you finding that there's a good mix of opportunities with supplements in the field of functional neurology and functional medicine with the gut-brain axis?
I actually am. It's pretty amazing how powerful these things can be. And it's one of the hot topics that we can discuss because it's a big deal is traumatic brain injury.
I'd love to if you have a minute. Yeah.
I do. I actually have a protocol that I have these athletes on for not only muscle recovery, because we want them back as soon as possible. So I have them doing things like creatine. I have them doing like magnesium. I have vitamin D in there, and then I have Therazyme in there because it can help break down some of that scar tissue and get them back quickly. But I've also added fish oil, and I've added the name just completely, the NRF2 activator.
Oh, so Sulfurazyme.
Oh, Sulfurazyme, thank you. That was a brilliant product that Eric brought to us. I have people take that preemptively, right? Because when you look at the mechanisms of traumatic brain injury, basically what we're doing is we are lighting up the brain's self-protective mechanisms, and it doesn't know how to shut itself off. So we have all these astrocytes that are supposed to be protecting these nerve cells, that once they start getting excited, they start going off like little hand grenades. And if they go too far, they can actually damage pathways permanently. But if we can have antioxidants there ready and waiting for that to happen, the reaction to that is much less. Now, post-incident, hey, there are some steps that need to be taken, but you can get them back quicker if we can restore blood flow faster, if we can help with gut issues faster. In fact, have you seen the studies, Roland, about mice? They took a bunch of mice and whacked them in the head. And when they whacked them in the head, they found occludin and zonulin antibodies in the mice.
Yeah, there's like an instant leaky gut like response from TBI. Absolutely.
Right. So you get these kids that hit their heads, and then their doctors tell them what? Go take Advil. Okay. Go sit in a dark room and hope it gets better. No, there's so much more you can do for these kids. We've got to get them away from some of these exciting neurotransmitters that they're consuming, like MSG, monosodium glutamate. And glutamate's a very powerful excitatory neurotransmitter that can just throw fuel on the fire. Aspartame. Okay, aspartame is half of aspartate, which is an excitatory neurotransmitter. Yet we have this idea that somehow diet sodas are better for us than the regular sugary stuff. But no, that's not okay. Hey, but again, I'm getting kind of fired up here about this. But you got to help.
Passion shining through. It's good.
Well, you got to help these kids with their gut health. You got to help them with their neurotransmitters. You know, and how does that apply to everyday people that aren't athletes? It's the same thing. Like, we've got to avoid those excitatory neurotransmitters. We've got to get them out of that like fight or flight response. Man, meditation is life-changing for that. Remember when I said in the beginning, nerves that fire together wire together? That goes both ways, dude. Like a daily morning practice of meditation will get that sympathetic response. Excuse me, we'll get that parasympathetic response hardwired, get it much easier to tap into, and all of a sudden your life around you is less stressful. Why is that? Your outside world literally creates your inside world. And if you can put yourself in a much less stressed environment, just internally by what you think, man, you are so far ahead of the game.
Yeah, I mean, the body, mind, and the spirit, if you will, or the body, mind, and the soul are all part of the one being, which is really good that you touched on that. Some of the stuff that you're touching on just briefly with the TBI, the brain stuff. What are some of the specific products that you would go to in regard to someone who's expressing brain inflammation and gut inflammation? How are you guys using them up at your space?
Okay, so again, I'm a big fan of Enzymes because of its ability to break down neurotransmitters. Excuse me, break down scar tissue. I got myself all fired up and I can't think my thoughts straight here. Hey,
take a minute and breathe. That's all good. You use your meditative techniques.
And some good old just water. So I love omega-3 fatty acids. In fact, there's some fascinating stuff about the correlation between omega-3s and omega-6s. The ratio should be 3 omega-3s to 1 omega-6. The standard American diet is 10 omega-6s to 1 omega-3. The studies done on violent criminals, it was 30 omega-6s to 1 omega-3. So don't tell me that omega-3s don't affect brain health.
I saw that study where they started to give fish oil supplements to inmates, and incidences of violence actually reduced and went down.
Isn't that wild? I wish we could put that in the water instead of fluoride. Did I say that out loud?
We can edit that. Don't worry about that.
a good omega-3, and there's a lot of good ones out there. I'm not going to single out any one, but I will say this: do not buy them from the box store. The stuff that comes in the clear capsules, it's already bad and doing more harm than good. I love D3 vitamin D, especially this time of year. We don't ever see the sun just because the weather here can be pretty sketchy. So I love omega, and I love D3 I love Immunozyme. So what I'll normally do in the beginning of winter is I'll start cranking Immunozyme myself, and then as winter tapers off, I'll go to just regular D3. So we use those. I do like to use a lot of magnesium, electrolytes. Like, it's surprising to me how many people are just their electrolyte status just sucks. Like they drink a ton of caffeine, but they don't take it in any salt. They're avoiding sugar, which is good, but they're not getting any magnesium. So we push a lot of electrolytes around here. There's one in particular that we really like. It's called Element. But don't think that you're going to get electrolytes from Gatorade or from Body Armor. That stuff's just trash. What else? Those are the big ones that we use. Gut repair. I mean, there's some great glutamate products that are out there. But the big thing with gut repair is just anti-inflammatory diet.
Mm-hmm. Are you noticing a lot of your clients who have gut issues and who have neurological challenges? Is it more on like the microbiome side of things, the dysbiosis and the overgrowth there, or is it more along the lines of the functional disturbances within digestion? Because you mentioned what the vagus nerve is doing, right? The vagus nerve is signaling all the organs of digestion, but this is what I've come to the conclusion of the last little while. So many people are focused on microbiome health. They're focused on dysbiosis and they think that's everything. But if you don't take care of the upstream aspects of digestion, well, you said it, what's getting to your colon is part of the whole tube. What digestive issues are you seeing that kind of correlate with some of the clients who are walking into the clinic with neurological challenges?
So you're talking about microbiome versus functional disturbances. You can't separate the two, in my opinion.
Mm.
Right. So we went through this pandemic, and everybody during the pandemic is spraying, Lysol on everything and trying to sanitize everything. And
Hazmat suits and bubbles.
right. And talk to Jeff Thurston for at least 15 seconds to get what he thinks about that. Hey, like it's just absolutely horrific for our microbiome. Like we're messing up our gut bugs all over the place. Well, if you take that and you layer that on top of the standard American diet that's full of glyphosate, which disrupts your microbiome, okay, and you layer that on top of this stressed out, working your 9 to 5, trying to pay your bills, trying to keep the kids happy, the exes at bay, and all this stress that we have in our lives, that's going to disrupt our microbiome. So I really don't think you can separate the functional from the microbiome part because they're so intertwined.
Hmm. Are you guys going more towards digestive support? Are you going towards probiotics first, or do you kind of use them concurrently as part of a protocol to help someone who's trying to regenerate their GI health?
So our knee-jerk reaction is to go to probiotics first.
Okay.
And the reason for that is if you really start digging into somebody's history, and if you go all the way back to the time that they were born, oh, guess what? They were a C-section baby. So they never got that inoculation of neural flora from mom's vaginal canal. Oh, they were an earache baby, so they had ear infection. So their first their first antibiotic was at 6 months old. And oh, by the way, they were raised in a house like mine, so it was like antibiotics after antibiotics after antibiotics. Like their normal flora as a whole never really has a chance to survive. So I think it's important to get that going from the beginning, and then start supporting digestion. So what we like to do is get their diet cleaned up, but get them on a probiotic. And then whatever that doesn't help clear up, then you can start segmenting some of this. But you have to be a clinician about it too. Like you can't just say, oh, well, here's my favorite probiotic, take this. Well, no. What if there's someone like my wife who has a Th1, Th2 imbalance? She's going to do better with like a bifidobacterium mix in the beginning, and then you can move her to and it's hard getting through to people too, because they're so ingrained into thinking things like yogurt is good for them because it has acidophilus in it.
It's also got fancy commercials with people dancing with happy guts.
Right, exactly. Attractive people with happy guts. And you have to really sit down and educate them. Like, here's the difference between a good bug and a bad bug. And one of the things I learned a long time ago that I love to use is like when we have bad gut bugs, the aerobic kind, those bad bugs eat your toxin, or excuse me, they eat your nutrients. So the food that's supposed to be your energy are being consumed by these bugs, and they're pooping toxins, leaving this microfilm behind. Versus if you have good gut bugs, they're going to eat the toxins and poop out energy. So they actually poop out nutrients that your body can use. Okay, so if you can get that balance first, that'll help a lot of what you're trying to accomplish with a little bit of effort.
Yeah, because there's some really interesting research that talks about, the tight junctions in the gut they have a very similar structure to the junctions of the blood-brain barrier.
Right.
So I would imagine what a lot of people are demonstrating and what you're trying to do with cleaning up the GI system is you're trying to reduce the systemic burden of inflammation, like within the entire body. Because if the blood-brain barrier is leaky, things are getting in there that are going to cause, I guess, what you described as like a low-level TBI-like response, piss off the immune system, and then they're going to show up in your office going, "No one can fix me, I'm broken. What do I do?"
Right. With a Diet Coke in their hand.
Oh, there's probably a 2-for-1 special at 7-Eleven. So if people are wanting some basic tips and tricks from a functional neurologist to improve the function of the nervous system, you mentioned a few things like
Sure.
meditation. What are some basic things that people do? Because the nervous system itself doesn't get a lot of publicity unless it is something like you mentioned with a TBI or a neurodegenerative condition like Parkinson's or Alzheimer's or something of that nature.
Right.
What are some practical daily practices that people who are maybe in the functional medicine world can start doing with their clients without needing to study the functional neurology program?
So from a 30,000-foot level, or a foot view, excuse me, I like to say whatever a government agency says for nutrition, do the opposite. Right?
So don't eat the standard American diet. Step
Exactly. First and foremost, you have to eat fat. You have to consume good fats. If you don't have,
what would you classify as good fats?
Grass-fed beef, and don't steer away from the fattier cuts. They taste good for a reason. Okay, so grass-fed beef here. We have a lot of hunters here that get all excited when I tell them to eat their wild game, but wild game. Wild caught fish, not the farm raised stuff. Specifically, I think about salmon. Hallelujah. My father-in-law loves to go fish Alaska every year, and he comes home with salmon that lasts us literally a year that he caught himself.
My mom's cousin used to smoke his own wild caught salmon on the side of where he caught it. He brewed and smoked salmon for me for a good solid 18 months. I couldn't eat anything else.
That's awesome. Free range poultry. The fattier cuts like the thighs and things, and then supplementing with a fish oil. So focusing on those, getting rid of grains. Hey, when you get rid of grains, you're getting rid of all grains, gluten, all of the grains that can look like gluten, etc. And then focusing on fruits and vegetables, low glycemic fruits and vegetables. So when people come into my office, and I know I'm going back to the weight loss thing because it's the hot topic right now. Our weight loss program is basically you intermittent fast, so you skip breakfast, and then lunch is 12 ounces of fruit. Excuse me, I said that wrong. Lunch is 4 ounces of fruit, 4 ounces of vegetables, and 4 ounces of protein. Okay, so the protein is where we focus on the fat. The fruits are the low glycemic fruits, and the veggies are the low glycemic veggies. That would be the exact same if they were coming in to see me for some sort of functional neurology issue. When you're only eating 4 ounces, a 4-ounce cut of steak, a 4 ounces of broccoli roasted in extra virgin olive oil, and some blueberries, there's not room there for some of these grains that are neurotoxic.
Hmm.
Does that make sense?
Perfectly. Yeah, I agree. I mean, happy gut, happy brain, happy gut-brain axis.
Right.
Not to mention you're nourished at the same time and avoiding things like blood sugar swings, potential food allergens, foodborne toxins, stuff of that nature.
Amen. And I tell people one of the easiest things that they can do to make a change right now, their family won't even know that they did it, is to go home and throw every fat away, every oil away, except for extra virgin olive oil, coconut oil, avocado oil, and butter or ghee. Like,
I have most of those in my pantry as we speak.
we don't even own a thing of sugar in our house. We don't use any of the other oils at all. But those, they're very simple. Like, it seems like superficial, but man, there's a lot to just those simple things.
Well, mastering the basics is something that people kind of fall out of love with because there's sometimes a love affair in the world of health and alternative medicine with the shiniest new object. Give me the one pill that's going to jack up mitochondrial function, whatever it is people are chasing. But if you don't do the foundational things that all humans need to be optimal, you're missing everything.
Right.
So that means, so it sounds like what you're saying is make sure that you get your diet in an optimal working order for you. Take out the things that are known potential allergens, or we'll call them dietary hazards, because anything that's going to be toxic to the gut, disrupt the gut function, is going to be problematic to the brain.
Right.
You mentioned meditation. Are there any specific techniques within meditation or breathing or anything of that nature that you'd suggest?
So my favorite book on that topic is Breaking the Habit of Being Yourself by Joe Dispenza. And I thought it was going to be the kids that were bugging me, but it's the dog sitting outside the office looking at me longingly barking.
Another time.
But that Joe Dispenza book is fantastic. But you all have one of these. There are playlists. I don't know, but I can't speak for Androids because this is an iPhone. But I'll go onto iTunes and I'll literally just search in iTunes for guided meditation. Tons of stuff comes up. I mean, you can look it up on YouTube, guided meditation, and there are literally free resources that will walk you through things like how to box breathe and like how to just focus inwardly and take a few minutes of your day just to look inwardly to build those pathways.
Got it. And how about sleep? Because we know the brain will shrink in an underslept state. Are there any specifics when it comes to optimizing your sleep besides obviously the blue blockers? Is there like time of day, a temperature setting, anything specific?
Temperatures, well, the time of day is obviously we want to sleep when it's dark, right? That's not always possible for people, but that gets tricky. 7 to 8 hours should be your goal, right? So if you have an early morning routine or you have an early morning job, you got to go to bed earlier. There's two things that I do in our home that make a big difference for me, but they piss off. Well, one of them pisses off the teenagers. Like our Wi-Fi.
You unplug the Wi-Fi, don't you?
No, but if I aimed the camera down there, you would see that there's a timer. Like those old school, like we're out of town, we want the lights to come on so it looks like we're home timers. Our Wi-Fi shuts off at midnight.
Perfect idea.
That's my compromise, right? If it were up to me, I'd say 10 o'clock it's done. But we got teenagers. So from midnight till 6 a.m. the Wi-Fi's off. Okay. And the other thing that I do is I mouth tape every night. And it doesn't need to be fancy. You don't need to go spend a bunch of money for one of these mouth tape things on your social media. Mine's literally a piece of athletic tape. It's barely enough to get to the corners of my mouth, and I just slap that sucker on there every night. Okay, just think about for a second. If we are under stress, if we're being chased by the tiger, how are we breathing? Right, we're breathing through our mouth.
Sympathetically dominant pathway, right?
That doesn't bode well for good sleep. when we're resting and relaxing and we want a parasympathetic response, we want our nose to do what it was designed to do, and that is to start filtering out toxins, cooling the air as it enters into your system, then tape your mouth shut. Right? And it's surprising how much that makes a difference. A couple of other things is just make sure there's no light sources in your room. Get your phones out of your room. That's not possible. The phone thing isn't possible for some people because, again, we got teenagers that we're trying to wrangle and we get calls at weird times. But it's just making these little changes make a big difference over time.
Mm.
And I happen to sleep better when it's cold, and that's just me. So
I think that's most people, unless, I mean, we're talking frigid temperatures. I think the human body does like a little bit of a cooler temperature at night to induce more restful sleep.
like to cuddle up in those cozy blankets. And
Hey, man, why
So-
not? You're up north. You're north of the Mason-Dixon. You're dealing with all the crappy weather this time of
So,
year.
I do have my 9-year-old, and we just started this the other night because when he's at his mom's house, they practice some things that aren't quite so conducive to sleep. So when he's here, he's like, "Well, Dad, can I just take a melatonin?" No, you can't just take melatonin. There's other ways to do this. So I actually started lasering his brain last night, and he slept like a rock that night. So I'm like, "Okay, cool, we're on to something here."
Dad, can you laser my brain? It sounds kind of a weird request, but it seems to work.
I will send you a picture of it today before he goes to bed.
Amazing. Awesome, dude. Well, Brady, I want to thank you so much for being the guy who said yes to an interview between Christmas and New Year's and giving us a lot of insights as to what
Hey.
functional neurology is, the gut-brain axis, and how everything interrelates. Is there any final thoughts, final parting words that you want to share with anyone who may be watching this live or is going to obviously watch the post recording at another time in 2023?
Start meditating, write down your goals, visualize what 2023 is going to look like for you. Need help with that? I'm available.
There you go. I'll make sure to give everyone your personal phone number and email address.
You do
Thank you
that.
so much, my friend.
Hey, let's